After you have a total shoulder or reverse total shoulder replacement, you're going to be wearing a sling on your shoulder that will be on all day and night except for exercises and for your hygiene and self-care activities. Besides the sling, there are a couple of other precautions you're going to be following. If this was my operative shoulder, one of the things I don't want to do for at least the first several weeks is to actively move my shoulder on my own. Therefore, I'm not going to be able to use that arm to do things such as pulling on socks, pulling up my pants, etc. The other thing you'll want to be careful not to do is to rotate your arm away from what we call a neutral position. So when you're in the sling, your arm's going to be positioned like this. To get your arm in and out of the sling, you don't want to just lift it in and out like that. You have to use your other arm. So you'll be lifting it in and out like that. Just make sure you don't push it out like that. For the first few days, at least after surgery, it will probably be beneficial to have someone help you, not only with the sling, but also to help you do your daily activities like washing up and dressing. The nerve block that you're going to have will affect your sensation and your movement of the lower part of the arm. So it's going to be a little tricky at first to get the sling on and off and etc. So it will be helpful to have someone help you with that. I'm going to be just talking about a few things that may make things a little easier after surgery. One of the things that will be helpful is to wear shirts, pants, socks that are a little looser fitting. They'll be easier to get on. Some people find that getting on a front opening shirt is going to be easier than getting on a pullover shirt. If you do find a pullover shirt is easier to get on, it typically is easier to have it larger than usual and maybe be a stretchier material. To button, you'll just be able to button one-handed, so you might want to just watch that you don't have shirts with tons of buttons in case you're having difficulty with that. You're going to want to try to wear looser fitting elastic pants because it would be hard to do things like buckle and snap and button. When you are going to be getting your shirt on, again, let's say this left arm is my operative arm, you'll want to put the sleeve over the operative arm first. It'll be a lot easier that way. So I would do something like this, where I would use my other arm to pull my arm up. And then you can pull across like this and get the other arm in. For women, you won't want to likely wear a bra for the first several days because the straps will probably be uncomfortable, as well as it'll be difficult to get on and off. For at least the first 2 weeks after surgery, the surgeons recommend that you wear these compression socks, sometimes called TED hose. And you probably know that they're snug fitting. So these would require 2 hands to get these on and off. So there again, it would be helpful to have someone help you. These will be worn during the day and taken off at night. In terms of shoes, you'll probably want to wear shoes that either Velcro, that you can just hook and unhook with your non-operative arm, or just slip-on shoes. You will have a bandage on your shoulder that will remain in place until you go to see the orthopedics at about 2 weeks post-op. You don't want to get that bandage wet, therefore it might be easier to sponge bathe, or some people will put plastic wrap or press and seal over it, but you just want to be very careful not to get that area wet, get that bandage wet. In order to wash under your armpit or apply deodorant, you could either go up to a counter or a table, take my non-operative arm and just gently move my arm out of the way and rest it on the counter and wash there. Or what you could do is lean over, which naturally causes your arm to come away from your body, and then you could wash there and apply deodorant in that position as well. After surgery, you will probably find it is more comfortable to sleep in a recliner where you can sit semi-reclined versus laying flat on your back. And you will be wearing the sling while you sleep, and it may also be helpful to have pillows on your arm and the sling just to help support it a little bit more and make you more comfortable. You'll be seen by an occupational therapist prior to your discharge from the hospital. The therapist will review with you how to get the sling on and off, how to do your exercises, and will have you get dressed to make sure that you are able to manage your clothing yourself, and or that you have assistance with that, and we may be able to provide you with some other additional tips to help with that.